Hello, good morning. I am Dr. Madan Reddy, Consultant Neurosurgeon, Apollo Hospitals Hyderabad, Hyderabad. Today, I will be talking about stereotactic biopsy of brain lesion. Basically, stereotactic biopsy means taking a small bit of abnormal tissue in the brain for testing, which is used for diagnosis and further treatment. There are two methods in which stereotactic biopsy is done. One is called as frame-based stereotactic biopsy and other one is frameless stereotactic biopsy. If you technically talk about what is a stereotactic biopsy, it is a method by which we are going to obtain 3-axis XYZ axis for a lesion that is somewhere deep-seated within the brain, which is not usually approachable directly. So once we get the coordinates, we send a thin needle into the tissue, take a small bit and send it for testing by pathologists or microbiologists based on whatever is required. So in frame-based stereotactic biopsy, we are going to fix a frame to the head of the patient under local anesthesia, do a CT scan. Using the software in the CT scan, we obtain the coordinates, all three XYZ coordinates, and we go ahead and take a biopsy from the desired target. In case of frameless stereotaxy, it is done using something called a stealth navigation system that we have in our operation theatre. In this, there is no frame required, but we are going to obtain targets within the brain using a software and radio optics technology where we get the XYZ without using the frame and make a small hole in the skull through which we pass a needle and take the biopsy. Advantage of frameless stereotactic biopsy over frame-based stereotactic biopsy is that we can keep changing the target and get multiple biopsies at the same time. Whereas in case of a frame-based stereotactic biopsy, we can adjust or get only one target and get a biopsy from the same target. Apart from this, if at all you have to differentiate between which is good, what is good, frame-based or frameless based, yes, both are equally good. The error rate is very minimal in both of them, and here in Jubilee Hills Apollo, we have both frame-based and frameless stereotactic biopsies that are available. Once we get the biopsy, we send it for a pathologist. Pathologist is going to give us a report immediately using something called as frozen section, where they are going to tell that whether tissue taken is abnormal, is it the representative of the biopsy of the abnormality in the brain. After that, the complete processing is done and report is given in the next 3 days' time, where we will come to know whether it is a tumor, if so, what kind of a tumor, what grade of a tumor. Based on that, further treatment will be planned and executed. Thank you.